Welcome to SHE, Sustainable Health Empowerment's Health Education Series. I'm Mei Mei Giang. This is the second in our four-part series on breast cancer. In today's telecast, we will be discussing breast cancer, which is the most common cancer in women in the U.S. and globally, aside from skin cancers. Last week, we explored the anatomy of the breast, what breast cancer is, and briefly looked at stages of breast cancer. Today, we will discuss why some women are at higher risk than others. So let's jump in. This is what we'll learn today. One, we're going to recognize myths about what causes cancer. Two, we will identify risk factors for breast cancer. Three, we will identify ways to reduce the risk of breast cancer, especially lifestyle changes. Let's explore the risk factors for breast cancer. Though we don't know why some people get cancer and others don't, there are things that we do know. We do know that bumping, bruising, pressing against a breast does not cause cancer, nor is cancer contagious. We do know that there are risk factors for developing breast cancer. Though figures vary, it is now judged that only about 15 to 20% of breast cancers are genetically linked, which cannot be controlled. That means there are other risk factors that can be controlled. 1. Age. The chance of developing breast cancer increases as people get older. Most women are older than 60 when they are diagnosed. But breast cancer can also occur in young women. In fact, data suggest it is the most common type of cancer among young adults, 15 to 39 years old. And these cancers can be more aggressive. Also, certain ethnic groups, such as African Americans, are at higher risk for certain cancers. 2. Personal health history. Having breast cancer in one breast increases the risk of getting it in the other breast. 3. Family health history. Your risk of breast cancer is higher if your mother, sister, father, or daughter had breast cancer. The risk is even higher if they got the cancer before 50 years of age. Having other relatives with breast or ovarian cancer also may increase your risk. 4. Reproductive and menstrual history. The older a woman is when she had her first child, the greater the risk. And the risk is also greater for a woman who have had no children. Women who have their first menstrual period before 15 or who go through menopause after 55 are at a greater risk. Women who use hormone replacement therapy for long periods also are at increased risk. 5. The risk of getting breast cancer after menopause is also greater for women who are overweight or obese. 6. Lack of physical activity. Women who are physically inactive throughout life may be at increased risk. 7. Drinking alcohol. Studies show that the more alcohol a woman consumes, the greater the risk of breast cancer. Remember, having a risk factor doesn't mean someone will develop cancer, but it does mean it is important to have regular checkups and to change behaviors that are risk factors. What can you do to reduce your chances? Again, we are talking about things you can change, known as modifiable lifestyle factors. 1, you can eat a low-fat diet. 2, you can lose weight if you are overweight. 3, avoid excessive amounts of alcohol. 4, exercise. And 5, get annual checkups. Next week, we will focus on symptoms and detection of breast cancer, as well as how to do a breast self-exam. Though breast self-exam cannot replace a doctor's exam or a mammogram, it does lead to early detection in some women. Thank you for tuning in, and be sure to check out our next episode on breast cancer and all the episodes in this health series. We'll see you next week. Here's to good health and good habits.